Dentists and dentists in training at the University of Oklahoma College of Dentistry know Halloween is a spooky time. It's not all the witches, ghosts, and goblins, though, that scare dentists this time of year. It's the monstrous amount of candy their young patients will consume. The fact is, sugar and teeth, well, it's just a recipe for decay.
The bacteria use sugar as part of their process, and they take that sugar in and then they turn it into an acid.
That acid eats away at tooth enamel, and that's what leads to cavities. So, what's a parent or grandparent to do when their little trick-or-treaters come home with a fresh bounty of treats? Pediatric dentists at OU say, take control.
First of all, I would try to limit the amount of candy that they're going to eat, when it's available, and how long you're going to let them keep it after Halloween.
Dr. White says it's not realistic to tell a child not to eat any of the candy he or she collected.
You having a good Halloween?
But you can choose how much they eat and when. One of the best times for sweet treats is mealtime because saliva production is higher then, and the calcium and phosphate in saliva help neutralize the acid caused by sugar. Just before bedtime can be a good time for that sweet treat too, because children should be brushing before climbing into bed anyhow. Just make sure they brush well, and remember, smaller children need help with brushing.
It's always a good time to reinforce good toothbrushing and flossing, and so you might make it part of the deal that if you eat candy, then that you have to brush afterwards.
It's also important to note that all treats are not created equal when it comes to our teeth. Sticky, chewy, and hard candies such as suckers keep sugar on teeth longer. There are better choices.
Probably, as far as candies go, chocolate probably might be a better candy. There are some studies that might show that it's less cariogenic than other candies.
That means less of a cavity threat. Better still, dentists say give different treats this year. Individually wrapped prizes, toys, unpopped popcorn packets, nuts, and other items are all good alternatives to traditional Halloween candy. Dentists at OU say simple steps, a little control, and a few compromises can keep it a fun and tooth-friendly Halloween. This is Teresa Green reporting.